Information Center yesterday. We had 23 positive cases out of about 600 some samples. So again, let's get into it. What can you tell us about these 23 positive cases of COVID-19?
Okay, thank you, Chris. If you look at the number of tests being performed, we're still trying very hard to continue our active case findings in the community. So public health is not relenting on our efforts, to continue testing. And what it shows is that while we are on one hand, trying to get the whole island vaccinated, to get that herd immunity, we do not lose sight of the fact that we also are still in the pandemic, and we continue to test, to see if there's an ongoing transmissions in the community. And we're also looking at, what cases we have, looking at if they are symptomatic or asymptomatic. We are also very focused on their vaccination status, because what we're trying to do is what we're trying to figure out is, what impact the vaccination is having on our island, and then going forward with these numbers, we would continue encouraging people to get tested. So going back to the cases, these were cases that were detected between the 9th and the 11th, and the 22 cases were reported locally, from our local labs, and then one case was reported by the DoD lab, which is Navy. We've actually completed 19 investigations out of these 23 cases. We've been able to initiate one case investigation because the person is currently hospitalized, and then we've had 2 unsuccessful attempts on 2 of those cases. And this goes back to us asking for, the right information to be put in the paperwork that is submitted to public health by these individuals that are being tested, so that we'll be able to, reach out to them in case they turn positive for COVID. So that is what we have for now on case investigation. And then out of these cases, 6 of them are symptomatic, and 16 of them are asymptomatic. So that is good, to see that people are not getting really sick, but it still doesn't mean that people are not getting infected. And also looking at the vaccination status, that is where we are actually looking at deeper, because out of these 23 cases, only 2 of them are fully vaccinated. Only 2. One is partially vaccinated, and then 19 out of them are unvaccinated. Out of this 19, 9 are ineligible. So these are minors that are under the age of 12. And looking at that number now, you're seeing that there are 10 people who are eligible for vaccination who are positive from this number. So we that's why we consistently encourage people to go get vaccinated. And then out of this, 11 of them were actually household transmissions. So 11 of these cases come from households 11 of them come from households. 3 were just community exposures, and some of them were sporadic exposures that we're still trying to investigate if there's any link between them. So that is what we have today for the 23 cases.
So don't be alarmed. It's 11 cases through household spread, Chima?
Yes, but you see, we have to look further down the road, So we're seeing minors, who are not of age to get vaccinated, getting infected, right, by adults who are not vaccinated. But also, yes, we understand that kids rarely get sick, when they are exposed to COVID. But we're looking at the cycle of transmission. So you're looking at an adult who's unvaccinated exposes these young kids. Good enough that our numbers are low because we're on summer vacation. So can you imagine, if the schools were open and we have all these kids, who are positive that are exposed to these unvaccinated adults go back to school. So we're going to have an increase in a number of ineligible minors getting infected, through these adults who refuse to go get tested. So I think we should also really worry about, our role in protecting our minors. I think it's a responsibility that everybody should take seriously, because these kids' social circles are very small. They're on vacation, they're at home now, but if the schools open and these kids go back to school, we might see an increase in numbers, of minors who are not of age to get vaccinated getting infected. So is that rippling effect, that is caused by this little number of adults who refuse to go get vaccinated, that will create the next problem that we're going to have amongst these minors who we are supposed to be protected. And the reason is, for vaccine preventable diseases, we are looking at herd immunity, is about people that have the capacity to get vaccinated, having that immunity to protect the little number of people who cannot get vaccinated. So the cases are reflective of that. We're seeing families where adults are unvaccinated infecting 6 to 7 kids in those households. So imagine if that adult is vaccinated, then there's very little chance of them getting infected and infecting those kids. So I think it's a responsibility that adults should take seriously. We need to protect the younger ones. And with this whole new variant, with this whole new Delta variant that we've successfully kept out of the island, if for any reason that these unvaccinated adults get infected, these are going to be the reservoir for infecting other people who are unvaccinated. So we have to look at this and try to balance it out. So the long-term impact might not be favorable if we do not have these adults vaccinated. So public health is having this huge, massive drive, to get everybody vaccinated. The government is giving out incentives. We're literally begging people, to help us protect ourselves. And we hope that our messaging, our appeals, will be taken seriously and people would go get vaccinated. Thank you.
Chima, you said that we've managed to keep the Delta variant out of Guam. How confident are you in that statement? Have we sent any of the recent samples off? Because I know that the samples we have sent, none of them have come back positive for the Delta or the Delta Plus variants.
Yes, and that's why I'm saying that we've successfully kept it out, because if you're looking at our entry requirements into the island, right? Which is the vaccination, and now we've moved up to testing, right? So if you couple that with the fact that locally we're still following public health recommendation of wearing our mask, and keeping safe distance. So people who are coming on island are getting on that plane without active infections right now. So because we're doing the 72-hour test before arrival, and then with vaccination, the people who are being exposed, some of them are not getting, the people who are vaccinated are protected against, the virus up to an extent where they're not going to get sick, or even if they get infected, they won't have enough viral load to, infect a lot of people. So that is the good part. So the policies we have in place is actually helping us. And like I said earlier on, we continuously send out specimens to go get tested for variants. The last variants that the last result that we got were all the UK variant. So we're still actively, sending out specimens to go get tested. And if for any reason we identify the Delta variant, our processes in place will also help us to make sure that we cut off transmission as early as we can. So I think we're in a good place, with what we're doing, and then with the commitment from the community, we will continue to remain protected, and public health will not stop being vigilant.
I'm just looking at the latest JIC report. So it does say one case identified with the B1617.2 Delta variant. So is there a different Delta variant we're talking about?
Yeah, yeah. So I think there's a more aggressive Delta variant,
Okay.
which I might have to look up to discuss further because I wasn't prepared for that. But the fact that we've actually had one on island and we were able to handle it and it didn't spread was what I was trying to put out there. That so it's not that we've not had it. We've had it and we are able to successfully contain it. And
So
we hope
just
that we
need
don't get another one. We hope we don't. We just hope we stop having positives. For me, it's just not about the variants. It's about people turning positive. We can actually stop it. If people are vaccinated and are wearing their mask, I don't think all these 15 cases, 20 cases. I think we should come down to the single digits. As we continuously push for the herd immunity that we expect in a few days.
So just to clarify, you said earlier that we've been successful at keeping the Delta variant out of Guam. What you meant was that we've successfully contained it.
No, we've kept it out because that one, remember the one case was the major case that everybody got excited about, that we tried to explain that, the public health protocols are simple and straightforward. We detect a case, we isolate the case, we ensure that the contacts are traced, are quarantined and tested if they are positive. So that is the process. So there was no denial that we've not had the Delta variant. It was one, and this was I think at the beginning of the year, when we've not had the more aggressive variants, being publicized the way it is being publicized now. But since we've had that one case of the Delta variant, we've not had any Delta variant up to this point.
Okay. You good?
Yeah.
Chima, anything in closing that you want to add here? Unmute.
It's just the same message, for people to go get vaccinated, because very soon, we are going to be seeing large crowds, and these large crowds would be a source of concern for us, if people are not following public health recommendations, and people who are unvaccinated becoming part of this crowd. And what we're looking at is, public health has guidances. The JIC is very clear. The EOs are very clear on gatherings. But what we're worried about is what happens after the gatherings. We have all these recommendations and all these strategies in place. To contain transmission in these large gatherings. But it's looking at what happens outside those large gatherings or before those large gatherings. So I think people getting vaccinated is key, for us to, continue living our normal lives, and then public health and the government will still, appeal to people who are unvaccinated to go get vaccinated, and we sincerely hope that we'll come out of this pandemic, very soon. That's my message. Thank you.
Peace Corps 4 on Liberation Day. What do you think?
What was the question again?
The governor announced that we're probably going to go into Peace Corps 4 on Liberation Day.
Yeah, I think we're in a good place to go to Peace Corps 4. But like I said, it is now individual responsibility. Go get vaccinated, wear your mask, keep your safe distance. The government has done enough, to protect us, to make sure that our numbers come down. All those policies that the government and public health had in place is reflective of the position we're in right now. So moving forward, I think there won't be any problem, going to Peace Corps 4. But the challenge will be, what will happen when people stop being vigilant and our numbers start getting up again. So we have to be very careful, and we be rest assured that if the numbers start going up more than it's supposed to go up, public health will come up with interventions that might not be favorable to people, but we have to do that to continue keeping the island safe. So I'm optimistic that we're there, and like the governor said, people should continue to wear their mask, even if we're in peak or 4, and make sure that we continue to be safe. So I'm optimistic that we're there already.
Chima, I did want to ask a couple of questions regarding all this military training exercises that are going on. There's 4,000 here for Forager 21. Then we just got word about this other exercise, Pacific Iron. We're talking about 35 aircraft, approximately 800 airmen coming in. Are they letting you guys know, the military, whether or not any of these airmen are vaccinated or anything like that?
Of course, like I said, out of the 23 cases last week, there's just one DOD. So we have more cases than them. so we're informed, there's a reporting requirement by law, to the local authority for infectious disease. And the military actually adheres to that law, which is good. So nothing is hidden, like I mentioned, we have 22 local cases and 1 DOD. So if there's anything happening in there, they will let us know. We've had that partnership with them long enough for us to trust what they're doing.
Mm-hmm. There was something else that the governor said. I believe it was on MSNBC, the Rachel Maddow show. And she was mentioning how she's meeting with her cabinet, in preparation and possibly even in anticipation of Afghan refugees possibly coming to Guam. So can you talk about what public health is doing in preparation of that possibility in terms of COVID?
Okay, so like I said, at the level of the government, these discussions are going on, But on our level, we're actually trained, we're prepared for things like this, and there are structures in place, there are laws in place, and then there's also going to be support, if this is going to happen. So at this point, I don't think there's like the governor said, is still on the planning stage, and she wants to be part of the planning, and that is one thing that is very objective about what she said, is that being part of the planning brings things on the table, and they are addressed before the main event. So being proactive is key. So if there's anything that she wants us to address, if there's anything, any role we are supposed to play, is going to be clear, as these discussions open up, and then we will be ready to, provide our own guidances or our own contribution to the planning. But I think while nothing is set in stone, like she said, the planning is key to having a successful outcome. So that's where I'm going to leave it at.
Chima, just the final comments, with word that we are likely to go into PCOR 4 next week. I think we've all known in the past year, just as quickly as we can change back into PCOR 3 or PCOR 2 or PCOR 1. And it's all based on what we do as a community going forward. And so just your final message to the community.
Yeah, I think it is personal responsibility. The consequences of our choices would be the determination of what reactions public health we have. Right now, what is in front of us is that we have low numbers. There's little to low little single-digit numbers of transmission. And the testing is still the same. So we're seeing lesser numbers. we're trying to encourage more vaccination. So it is personal responsibility. Wear your mask, keep your safe distance, get vaccinated. If you do all this, we are rest assured that we are not going to have any more challenges. But if this is not done, then the consequences will be high numbers, and then we're reverting back to the PCOR 3, PCOR 2, PCOR 1. So I think my last word should be, people should please follow public health recommendations, and make sure that they adhere to what we recommend, and we'll continue to be safe until we get to that bridge, and then we'll try to cross it.
All right. Thanks a lot, Chima.
Thank you so much.
Okay,
All
stay
right.
safe.
Chief Public Health Officer Chima Mbakwem. And since we touched on that interview that the governor did with Rachel Maddow, we're going to go ahead and play this interview. It's relative to the